welcome to OU Medicine Chat. I'm Teresa Grain. Here comes the sun. We are talking skin cancer prevention with Dr. Thomas Stasko. He's with OU Physicians Dermatology. Thank you, first of all, for being here.
It's a pleasure to be here.
The sun arrives early in Oklahoma every year.
It does. So our risk develops early in the year rather than waiting until summertime.
Okay, so let's talk about that. What is the number one risk for skin cancer?
The number one risk is sun exposure. Now, it takes a combination of that sun exposure with fair skin, but those two, and they go together very much in Oklahoma, is what yields skin cancer.
Okay. What about family history and all that? Can that play a role?
Well, it plays a big role. So, we talked about skin type, and you inherit your skin type from your parents. So the more fair-skinned you are, the higher your risk. The easier it is for you to burn, the higher your risk. The darker your skin type, your risk is lower, but it doesn't go away completely. So all skin types are at risk for skin cancer. It's just that fair-skinned people have that biggest risk.
The biggest risk. Now, some people will say, well, I don't go out in the sun. I tan in sunbeds or tanning beds, whatever you want to call them.
Well, people talk about getting a safe base tan. There is no safe tan. So a tan is basically damage to your skin and your body trying to protect itself from that sun exposure. So there's no safe tan. Now, admittedly, people who do tan well, their risk is a little bit lower, but they get that damage acquiring the tan, so they're still at risk for developing skin cancer.
What about self-tanners? For people who don't, say, I want to have this color, but I'm not going to go in the sun, are self-tanners okay?
Self-tanners are okay. So these are the chemicals that you put on your skin that give your skin a tan-like look. And sometimes they're sprayed on, sometimes that's done professionally, other times they're ones you put on at home that you put on day after day to sort of get the level of tan that you want. They are safe as long as you have no problems reacting to the materials that are in there. But they do not give you sun protection. So you look like you're tan, but you're not, and you will burn right through those. So you have to be very careful with that part.
Okay, so that's going to bring us to sunscreens, and I brought a couple, and you were talking about how these are a bit different.
Yeah.
What are we looking for when we purchase a sunscreen?
Well, when you purchase a sunscreen, the first thing you're looking for is that it's broad spectrum. And it will say that on the label usually, broad spectrum, and that means it covers both UVA and UVB. Both of these are damaging. UVB is what gives you a burn, but UVA also can give you skin cancer. So you want to block both of those. And then you want it to be water resistant. And you want that not just because you are going to go into the water, but because this is Oklahoma. And you go outside and it's hot and you sweat and this will disappear. So you want something that is water resistant. And it will say that on the label as well too. So the FDA requires this to be on the label if it is the case for these sunscreens.
They both reference minutes too. I noticed that they said 80 minutes. I think it was 80 minutes.
So that's the test level. So they test it for 80 minutes of water resistance. So it will never say anything higher than that, and it will never say, as long as it's water resistant, it won't say lower than that either. So it will always say 80 minutes because that's what the FDA tests against. But basically, if you're going to be outside, long-term exposure, you should reapply every 2 hours.
Okay. Yeah. So good rule of thumb, every 2 hours. If you're swimming, more often?
If you're swimming, perhaps more often. But again, you've got 80 minutes of resistance from this. You probably have a bit longer than that.
Okay. So I would say if I'm swimming, I'm going to do it every hour just to be safe.
To be safe.
My kiddos are in the pool once an hour.
To be safe, every hour is fine. You go 90 minutes, you're probably still okay.
Okay. That's good to know. Yeah. These act differently too. Yeah. You were saying one is a spray, one is a lotion, and they have different mechanisms.
So again, the vehicle, this is the spray, this is the lotion, is just how it's applied. And there's no real difference between the two in terms of a spray versus a lotion or a cream. It's the ingredient that makes a difference. So first you pick what you like to go on your skin. And sprays go on very easily, so people really like them. You can't put them on your face directly. You have to put them on your hands and then put them on. And for anybody who has respiratory difficulties, I don't usually recommend the spray because if you've ever put these on, it has a bit of a choking feeling when you put it on. But I love them because they go on so quickly, and especially for kids, they go on very, very quickly. Creams, again, take a little bit longer to put on, but you don't have that problem with the spray. The ingredients come in two forms, and one is what's called a physical block. And those physical blocks are basically minerals that reflect the light. So they're titanium dioxide and zinc oxide. But they're in tiny particles, so you don't see them. They reflect back. Whereas the chemical blocks have chemicals that absorb these rays of the sun, change them to heat and then dissipate, and so that you don't get through to the lower levels of the skin where they cause damage. So most are combinations. So this one is actually a pure mineral or physical block. This one does not have any of the physical blocks in it, but many will have both in it as well too. So,
okay. Yeah. So, one of the things we learn is read labels and learn what you're reading, because I think most of us don't really know. We just look and see something and see a tanning lotion and think it's all the same.
No, and a sunscreen like this will have 3 or 4 different ingredients on the back. And the key with that is the companies know that they have to formulate these with different levels of different sunscreens to get that broad spectrum coverage that they want.
Okay. And again, we want broad spectrum because we're trying to protect against all the rays. It was funny because someone once told me UVB burning, UVA aging. And so when a lot of people say, well, I don't really worry about, sunburns, we do worry about wrinkles.
We worry a lot about wrinkles. And those UVA rays probably play a big role in melanoma as well too. So, people will talk sometimes, is there a danger to wearing sunscreen? Well, if there's a danger, it is that you don't wear broad spectrum coverage. You have good UVB coverage so you don't burn, but you spend all day in the sun, which you could never have done before because you would have burned to a crisp, and you get those UVA rays. And so that's why you want that broad spectrum coverage.
Time of day, does it matter?
It does matter. So the worst sun exposure is in the mid hours of the day. So somewhere between about 10 and 3 are when you get the most intense sun exposure. As the sun gets a little bit lower in the sky, it still is very warm, but the atmosphere is blocking a lot of the UV rays that will give us difficulties. So evenings, even though it's nice and warm and the sun's still out, you're probably pretty good. Early in the morning, you're good. The real danger early in the morning is you forget when 9:30, 10 o'clock is rolling around and you haven't put your sunscreen on.
I noticed that a lot of people who really work in the sun all day long, who spend a lot of time in the sun, they aren't out there oftentimes. I mean, they do cover up somewhat. Physical blocking of the rays is also important, correct?
And actually, that is the safest thing to do, is physical blocking of the rays with clothing, hats, and being under an umbrella, being in the shade rather than being out in the sun. And that actually is the best protection you can have from sun exposure.
I heard a woman who was from Thailand talking about that. She said from the time they are little, because they value that porcelain skin, they were taught. She's a picture of her at 2 years old holding the umbrella.
Indeed. Parasols are still big in Southeast Asia. So if you go to a park in Myanmar on a Sunday, everyone will be under umbrellas. They won't be sitting out in the sun. They don't want that tanning. Even though their risk for skin cancer is relatively low, they don't want that tanning.
Absolutely. Okay, let's talk about warning signs of skin cancer. What changes might we see, and how often should we be checking?
Well, it depends on the kind of skin cancer we're talking about. So the most common kind of skin cancer is non-melanoma skin cancer, which is basal cell and squamous cell carcinoma. So these are relatively slow growing. Their risk for metastasis is relatively low, but the thing you would watch for is for a sore that doesn't heal. So a red crusty spot that doesn't go away, a sore that doesn't heal, or it heals but it's back again 6 weeks later or so. But they tend, because they are so, what we would say, indolent, they grow so slowly, we tend to ignore them. But if you've got something that's growing, that's just not going away, those are things you need to pay attention to. Now, melanoma is the more dangerous kind, and it is the dark-colored skin cancer that usually looks like a mole that has gone bad, so to speak.
Okay.
And with that, we're looking at the A, B, C, D, E's of melanoma.
Let's look at some pictures, and that was one of the things I want to talk about, ABCs, because ABCs, we think about, know your ABCs. In this case, we know our A, B, C, D's, and E's. Okay, exactly. So talk about A.
So A is asymmetry. So, a spot that is a melanoma tends not to be regular. If you folded it over on itself, it doesn't match up from side to side. So it is irregularly shaped. It's asymmetrical. B is the border. And so the border on these tends to be notched. So rather than being a nice round, even border, it tends to be an irregular border that's notched, kind of cauliflower looking around those edges.
Okay.
C is color. And so there are variations in color. And it tends to be dark in some areas, lighter in others, sometimes with a little bit of redness in it, sometimes with some blueness in it. So your mole that is nice and brown and even colored is probably not so much to worry about, but that one that's got jet black areas in it, more to worry about.
Okay.
D is diameter, so just the size. Now, we pick for that 6 millimeters. Now, obviously there are melanomas that are smaller than 6, but in general, the smaller ones are not as much of a worry as bigger ones.
6 millimeters?
6 millimeters, size of a pencil eraser.
Okay, good way to
so
remember
it's an easy way to remember it. Bigger than a pencil eraser, think twice about it.
Okay.
And E, which is probably the most important, is evolution or evolving. So a mole that is changing. So you may have had that mole for 10 years and it hasn't changed, and all of a sudden it's doubled in size, or the border now looks irregular, or there are different colors to it. Those are the things that should take you right in to see your physician.
Treatment. Are we able to treat skin cancers?
We are able to treat skin cancers, and the earlier we treat them, the higher the cure rate. So even melanoma, which is the dangerous form, if it is caught early, before it's spread to any other places, which is usually the lymph nodes to start with, the cure rates are in the high 90 percentile range, so 95, 98 percentile. On the other hand, if it's caught much later, when it's bigger and deeper, those cure rates drop down into the 40% range. So that's why it's so important to catch these early rather than catching them later.
Check your skin regularly.
Check your skin regularly. So basically, I advise my fair skin patients to check their skin about once a month. If you check every day, you really can't see the changes. And if you wait 3 or 4 months, you don't remember what you looked like the last time. Okay? If you have a funny looking mole, or not really funny, but you're just a little bit concerned about it, take a picture of it. We all have cell phones now. We all can take pictures. You may need your partner to help you with some of this. There are ways to look at your back very easily with mirrors and all, but it is a bit of being a contortionist. If you've got a partner, though, they can look at your back for you. And I will tell you that what gets men in is their wives have seen it on their backs. And so they'll say, you've got to go see it, and they'll beat them over the head till they come in, kind of thing. Women are a bit better about looking at their own bodies and seeing what's going on.
Okay. Dr. Thomas Stasko, we are out of time, but we got some great information, and we have more for you on this webpage. So visit those links that are on that webpage. And again, Dr. Thomas Stasko, OU Physicians Dermatology, thank you. Great information as we head into summer.
It's been a pleasure being here. Thank you.